We are here with Dr. Daniel Severance talking about hip fractures in older adults. Dr. Severance, what kind of physical and emotional toll do you see hip fractures have on patients and their families?
It's a huge draw on them. They typically have a big loss of independence and mobility following a hip fracture, and so they go from a functioning adult that's out in the community to being in a nursing home typically for 6 to 8 weeks while they recuperate, to trying to struggle to get back to their mobility and their independent living. So it takes a big hit on the patients and their family members.
What is the most common type of treatment for a hip fracture?
So it depends on where they end up breaking their hip. There's two different varieties. We can either fix, so we put in devices, plates, screws, rods to fix it and keep their native bone, or in some instances they break in an area that doesn't allow it to heal, and so we do a partial or total replacement for a hip fracture.
And what do orthopedic surgeons like yourself do in the operating room to ensure the best outcomes possible?
I think the biggest thing is we have a team approach. So we have patients medically optimized by our hospitalist service, cardiologist, pulmonologist before the operation. They stay on board after the operation to make sure all their medical conditions are treated appropriately. In the operating room, we always want to make sure that we get the most accurate reduction of their fracture or the accurate placement of the prosthetic components that we possibly can. We ensure that we do all the infection control measures to keep our infection rates very low, and then make sure that they're monitored afterwards and treated appropriately for any of the possible complications like blood clots and bed sores and things that can occur with a hip fracture.
Care for someone with a hip fracture, we know it doesn't end in the operating room. Some reports show that up to 50% of patients with hip fracture actually die within 6 months. Many of those who do survive aren't able to return fully to the lives they once knew. So what are we doing outside of the operating room to give patients the best outcomes?
Yeah, absolutely. So there's a lot of follow-up. Typically a hip fracture patient I'll see for at least a year after their injury. We'll see it in every 6 or 2 month intervals, 6 weeks to 2 month intervals. We have physical therapy, occupational therapy that help take care of the patients both in the nursing home and an outpatient setting. We have closed a loop for their bone health with getting them into our osteoporosis clinic so that we can make sure that they don't have future fractures. We go through a lot of fall interventions, so at-home visits to see what possible modifications can be made in their bathroom, in their living room, get any trip hazards out of the way, and a lot of education for the patients and the family as well goes into the recovery.
Any advice for how someone can best help a loved one who has suffered a hip fracture?
Well, certainly the best thing is fall prevention. So getting involved in screening for balance, working with physical therapy to prevent falls, having one of the home assessments done prior to falling is always the best course. Having frank discussions with your family members. If you think that they're becoming frail but they want to live with their independence, sometimes it's better to plan and go into assisted living before you're forced to go into assisted living. And then certainly, you know, if they have a hip fracture, we have our certified hip fracture center. We do a very good job of rapidly treating hip fractures within 24 hours and 48 at the most for really sick patients, and getting you back and mobile as soon as we can.
For a complete list of Prevea Orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.